When I meet with patients who are considering these options, we review together the pathology report, the PSA level, and other aspects of their situation, and in the larger context of their general health, life expectancy, and functional status. No one treatment is the right treatment for all patients, but we have several excellent options at hand. If I could, I'd like to focus a little bit more on high-dose rate brachytherapy in my association with Dr. John Hayes. Dr. Hayes and I both were introduced to brachytherapy for prostate cancer at Long Beach Memorial Hospital in Southern California. Two of the world leading specialists were there at that time and were very gracious to allow doctors in training to come and spend time working with them. Dr. Hayes went on at the University of Utah to refine and improve on those techniques. And for many years here, I would refer patients to Dr. Hayes. They would travel from St. George or other areas of southern Utah and go to Salt Lake for a high-dose rate brachytherapy implant. I would see the patients then in follow-up. I had a chance to observe their PSA levels, which is a good indicator of their status, whether they've been cured or not, and also to inquire and examine them as to side effects and subsequent problems. And as a group, I felt those patients did very well. I would communicate with Dr. Hayes regarding my impressions, and he invited me to come and observe him performing these procedures. I did so, and I had the impression at that time that if it came to me and I had this diagnosis, this is probably the treatment that I would prefer for myself. With that thought, and anxious to pursue success for my patients, my relationship with Dr. Hayes expanded. He invited me to join him in partnership, and for many years, I would travel with the patients to Salt Lake and perform the implants here. This last summer, we were very pleased to build an addition on the Coral Desert Surgical Center where we can perform high-dose rate brachytherapy here in St. George. We use the same techniques, and for that matter, our staff has been trained in Salt Lake with Dr. Hayes. Relatively few centers perform high-dose rate brachytherapy. This is partly because it's very intensive in terms of personnel and time and expertise, and you have to do a lot of these to do them very well. The physicist who works with me does this exclusively and has for years.